This is likely to be a short and sharp wave, driven by XBB, but contributed to no small extent by reinfections. Our models show that it may well peak about 15,000 daily cases, 7-day moving average.
Hello, I'm Lin Li Fu. Thanks for joining us on ST Live. The XBB COVID subvariant is driving the new wave of infections, accounting for more than half of the cases. The number of COVID cases will likely peak at 15,000 daily in mid-November, up from nearly 8,000 currently. Calling it a short and sharp wave, Health Minister Ong Ye Kung told reporters this morning that while no safe management measures will be reinstated, the authorities are monitoring the situation carefully in the next 1 to 2 weeks. He said that bringing back the mask mandate or vaccination differentiated measures cannot be ruled out.
Should the situation worsen, but in a way that doesn't disrupt our normal lives, I think the obvious ones is number one, maybe we put back our mask. Say indoor or indoor and outdoor if the situation requires it. Number two, VDS, as MTF earlier on announced, we step down all MTF, we step down all VDS, but when the situation requires, we may have to step up VDS to an appropriate level in order to protect those who are not up to date with their vaccinations. So that we also cannot rule out.
Mr. Ong says that data show the risk of getting XBB is far higher for those who have never caught COVID before. The probability of a COVID-naive person getting XBB is 162.5 out of 100,000 people. For those who have been infected previously, the risk varies. It is very low for those who were infected in the last 1 to 3 months. But for those infected last year, the risk is almost as high as that of a COVID-naive person, at 147.4 out of 100,000 people. The good news is the latest strain may not be as virulent. MOH says there is no evidence that XBB causes more severe illnesses.
That XBB, while highly transmissible, may not actually be as virulent or lead to more severe infections compared to the other variants. This, of course, is what we hope for, because if we can have a variant that outcompetes all the other variants, but in fact contribute to less severe infections in our hospitals, that would be a lesser burden on our healthcare resources. And this is something that we will continue to monitor over the next few weeks to see whether this trend continues to hold forth, and therefore that might give us more confidence that our healthcare system is indeed more resilient and able to take the current wave in stride, without the need to reimpose other measures to sort of mitigate transmission.
MOH says for now, hospitals here will set aside more than 800 beds in the next 2 weeks for COVID-19 patients to cope with the increase in cases. Non-critical operations will be postponed to allow medical staff to cater to the needs of COVID-19 patients. Capacity at COVID-19 treatment facilities will also be ramped up to provide another 800 beds by November. Mr. Ong also called on Singaporeans to keep their vaccinations up to date.
As you know, yesterday we started the bivalent administration. Not too bad. We have about 4,200 vaccinations yesterday. I hope you went. First day crowded. Okay, it may get more crowded. I think it's within our expectations to have a volume like that. It's not our maximum capacity, of course. Today is half day. Sunday it doesn't open, but I think if we can see there's a lot of demand, we'll open over the weekend, 7 days a week. So if we want to do that, it will start from next week. But we are monitoring the demand for the coming week.
Our coverage continues on straitstimes.com and on Facebook as well as YouTube. Don't forget to hit subscribe to stay informed and activate the bell icon on YouTube to catch live news updates. I'm Lin Li Fu. Thanks for watching.